40 Pulmonology PANCE Practice Questions, COPD Part 2. Hello, welcome to the Science Guide ASAP Learning. Today we are going to be practicing 40 PANCE Pulmonology COPD Practice Questions. Be sure to watch Part 1 if you haven't already. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Question 21. What is the primary symptom of COPD? A. Dyspnea. B. Cough. C. Hemoptysis. D. Chest pain. Answer. A. Dyspnea is the primary symptom of COPD, occurring on exertion initially and then progressing to dyspnea at rest as the disease worsens. Question 22. Which of the following medications is not a bronchodilator? A. Albuterol. B. Ipratropium. C. Montelukast. D. Tiotropium. Answer. C. Montelukast is not a bronchodilator. It is a leukotriene receptor antagonist used to manage asthma. Question 23. Which of the following diagnostic tests is the most useful in diagnosing COPD? A. Chest X-ray. B. Pulmonary function tests, PFTs. C. Arterial blood gas, ABG, analysis. D. Bronchoscopy. Answer. B. PFTs are the most useful diagnostic test for COPD, as they can identify airflow obstruction and provide information about disease severity. Question 24. Which of the following medications is a long-acting beta agonist? LABA. A. Beclomethasone. B. Fluticasone. C. Salmeterol. D. Montelukast. Answer. C. Salmeterol is a LABA used to manage COPD and asthma. Question 25. Which of the following COPD medications has been shown to reduce exacerbations? A. Ipratropium. B. Tiotropium. C. Montelukast. D. Theophylline. Answer. B. Tiotropium has been shown to reduce exacerbations in patients with COPD. Question 26. Which of the following COPD medications should be used with caution in patients with a history of cardiovascular disease? A. Albuterol. B. Ipratropium. C. Tiotropium. D. Theophylline. Answer. D. Theophylline should be used with caution in patients with a history of cardiovascular disease, as it can cause arrhythmias. Question 27. Which type of COPD is more likely to cause hypoxemia, hypercapnia, and pulmonary hypertension? A. Emphysema. B. Chronic bronchitis. C. Asthma. D. Bronchiectasis. Answer. B. Chronic bronchitis is more likely to cause hypoxemia, hypercapnia, and pulmonary hypertension than emphysema. Question 28. Which of the following is not a common presenting symptom of COPD? A. Dyspnea. B. Cough. C. Wheezing. D. Chest pain. Answer. D. Chest pain is not a common presenting symptom of COPD. Question 29. What is the most common type of emphysema seen in smokers? A. Centrilobular emphysema. B. Panlobular emphysema. C. Paraseptal emphysema. D. Irregular emphysema. Answer. A. Centrilobular emphysema is the most common type of emphysema seen in smokers. Question 30. What is the hallmark spirometry finding in COPD? A. Decreased FEV1, FVC ratio. B. Increased FEV1, FVC ratio. C. Decreased FVC. Increased FVC. Answer. A. Decreased FEV1, FVC ratio is the hallmark spirometry finding in COPD. Question 31. Which medication class should be used cautiously in patients with severe COPD? A. Beta blockers. B. Calcium channel blockers. C. ACE inhibitors. D. Loop diuretics. Answer. A. Beta blockers should be used cautiously in patients with severe COPD. Question 32. Which of the following is not a risk factor for COPD? A. Smoking. B. Air pollution. C. Age. D. Physical activity. Answer. D. Physical activity is not a risk factor for COPD. Question 33. Which of the following is not a long-acting bronchodilator used in the management of COPD? A. Albuterol. B. Salmeterol. C. Formoterol. D. Tiotropium. Answer. A. Albuterol is a short-acting bronchodilator and is not used as a long-acting bronchodilator in the management of COPD. Question 34. Which of the following is the most appropriate treatment for an acute exacerbation of COPD? A. Inhaled corticosteroids. B. Inhaled long-acting bronchodilators. C. Systemic corticosteroids. D. Oxygen therapy. Answer. C. Systemic corticosteroids are the most appropriate treatment for an acute exacerbation of COPD. Question 35. What is the most common cause of death in patients with COPD? A. Respiratory failure. B. Pneumonia. C. Cardiac arrest. D. Pulmonary embolism. Answer. A. Respiratory failure is the most common cause of death in patients with COPD. Question 36. Which of the following is a complication of long-term oxygen therapy in patients with COPD? A. Hypercapnia. B. Hypoxemia. C. Pulmonary hypertension. D. All of the above. Answer. A. Hypercapnia is a potential complication of long-term oxygen therapy in patients with COPD. Question 37. What is the hallmark of COPD? A. Chronic productive cough. B. Shortness of breath C. Chest pain D. Hemoptysis. Answer. B. Shortness of breath is the hallmark of COPD. Question 38. What is the most common cause of exacerbations in patients with COPD? A. Bacterial infections B. Viral infections C. Fungal infections D. Parasitic infections. Answer. B. Viral infections are the most common cause of exacerbations in patients with COPD. Question 39. What is the preferred method of long-term oxygen therapy for patients with COPD? A. Nasal cannula B. Venturi mask C. Non-rebreather mask D. Tracheostomy. Answer. A. Nasal cannula is the preferred method of long-term oxygen therapy for patients with COPD. Question 40. What medication class is considered first line for the treatment of COPD? A. Beta agonists B. Anticholinergics C. Corticosteroids D. Mucolytics. Answer. B. Anticholinergics are considered first line for the treatment of COPD. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one. Be sure to watch part 1 if you haven't already.